So today we're going to talk about diabetes and the genetic link to diabetes and what that means when you get a result from an at-home test and it says that you're predisposed to diabetes. So first off, diabetes is a disease. There's two types in which your body has hyperglycemia. What hyperglycemia is a buildup of sugar in the blood. So how we transport sugar into the cell once we digest sugar or carbohydrates, we use a hormone called insulin that transports the sugar into the cell to be used for energy. So there's, like I said, two types of diabetes. Type 1 is an autoimmune disorder in which the body attacks the cells that make the insulin, so you do not have enough insulin to transport the sugar into the cells. With diabetes type 2 is your body, for some reason, becomes insulin resistant. Oftentimes, while there is a genetic link and it is shown to run in families, so if you have a parent or a sibling that has diabetes, you're at a much higher risk for developing it, is really triggered by lifestyle choices. So, for instance, people that are obese or have heart disease are at a much higher risk for developing diabetes than someone who has a normal BMI and has no heart issues. So while we do know of some DNA that has a genetic link, for instance, if you have a mutation in a protein that makes or produces insulin, then you are at risk for developing diabetes because you have that genetic mutation in that protein. Now, just because you get on your genetic test that you are predisposed to diabetes does not mean that you will develop diabetes. Oftentimes, we use a diagnostic test called hemoglobin A1C, which measures, it's just a blood test that your doctor can take, and it measures your sugar over the span of 3 months in the blood. So that is a diagnostic test that we use to decide whether you're pre-diabetic or you do have diabetes, and we use that to diagnose diabetes and not just the genetic test, which shows that you could be predisposed. Oftentimes you're just predisposed because of both family history of diabetes, family history of obesity. You could have a genetic mutation, but also there's different ethnicities that are at higher risk for developing diabetes. So if you're a certain race, or if you are overweight, you are at higher risk for developing diabetes. So if you do get a genetic test and it shows that you are predisposed to diabetes, you don't have to worry. Oftentimes you can control it with diet and exercise and controlling any heart disease that you have, such as high cholesterol, and you won't have to develop that diabetes. So just because you get a genetic test and it says you are predisposed does not mean that you will develop diabetes. And oftentimes, while it is good to get your genetic test done to show maybe if you are at higher risk because of your family history, you can start making those lifestyle changes now. Thanks.